Okay, I think I am going to cover a little bit of biliary dysfunction, just biliary atresia, and then I'll save the rest for Friday. Biliary atresia is a progressive inflammation, sorry about that, a progressive inflammatory process that begins very shortly after birth. At birth, the liver structure is normal. In the most common form, biliary atresia is called extrahepatic biliary atresia. You've got these delicate ducts outside the liver that are affected. White blood cells will invade the ducts, they become damaged, and they can wither, or they can completely disappear. Because that happens, then bile is trapped in the liver, and bile needs to move out of the liver. It can't just sit there. If the bile just sits there, then it will damage the liver and scar the liver cells. You get further scarring of liver tissue that can result in cirrhosis, liver failure, and if it's not treated, the child will die. It happens in 5 to 10 per 100,000 live births. Females are slightly more affected than men. There are 300 new cases every year. On average, you've got one case of biliary atresia out of every 15,000 live births. The problem originates during the prenatal period. The exact cause is unknown. It affects only newborns. It's not hereditary, it's not preventable, it's not contagious. If left untreated, the blocked bile flow is damaged to the liver, and few children will survive beyond the age of 2. So it most certainly needs to be treated. It looks something like this. There's obstruction or absence of the extrahepatic bile ducts. You get backup in the liver, producing 2 problems. You have malabsorption of fats and vitamins, which produces malnutrition, fat-soluble vitamin deficiencies, and growth failure. On the other end, you have inflammation, edema, and the hepatic cells degenerate, producing fibrosis, and it's that fibrotic process that ends up producing cirrhosis. The liver fails. You also have portal hypertension that goes along with that. The clinical manifestations. You have a full-term normal infant that develops jaundice after the age of 2 to 3 weeks. That's the usual history. The infant has, yellow eyes and skin. They have acholic stools. They have dark urine. All that's caused by the back of a bilirubin into the blood and lack of bilirubin in the GI tract. The abdomen may be swollen with a firm, enlarged liver. Weight loss, irritability develops as the bilirubin levels increase. They'll do blood tests. Lots of tests to rule out other possible causes of the jaundice and to diagnose the biliary atresia. If they do an ultrasound, they'll see either an absent or a very tiny gallbladder because the bile is not getting to the hepatic ducts to be stored in the gallbladder. They can do a gallbladder nuclear scan, that's a HITA scan. A radioactive dye that acts like bilirubin is injected into the infant's vein. And in biliary atresia, the dye is taken up by the liver but can't flow through the damaged biliary system into the small intestines. A liver biopsy may show these bile plugs, edema, fibrosis. These are typical features of a biliary system that's all obstructed, but they generally have to do surgical exploration to definitively make the diagnosis. Now, what do they do after they determine that a child has biliary atresia? Well, the therapeutic management, once diagnosis is confirmed, the preferred treatment is to remove the atretic bile ducts outside of the liver and to attach the small intestine directly to the liver at a spot where they find that the bile is accumulating or where they think it'll drain. So this here was connected to this here. Okay, this and this was connected. It was the intestine. So what they did is they severed the intestine, brought this piece up here, attached it to the liver to allow bile to drain into the intestine, and then the stomach and small intestine dumps its contents where it's then mixed with bile. Bile flow will be reestablished in this is called a Roux-en-Y or a hepatoportojejunostomy or a CASI procedure. Bile flow will be reestablished in 80%. 50% of kids get some establishment, 30% get complete establishment. They'll generally wait to do surgery on, I'm sorry, I didn't say that right. They want to do surgery before the child is 2 months old. So early diagnosis is very important. If they do the surgery before the baby's 2 months old, the success is much more likely. After 3 months of age, the success of this operation is pretty poor. For this reason, all infants who have jaundice at the age of 4 weeks should be evaluated for biliary atresia. I said 50% get some relief, 30% will have complete bile drainage and their bilirubins return to normal. About 20% of infants will not be helped by the CASI procedure, and in these cases, the only other treatment option is a liver transplantation. It's real important to have adequate bile flow. Okay, we got this already. Got that already. Adequate bile flow is needed for digestion and absorption of your dietary fats and fat-soluble vitamins, including A, D, E, and K. When bile flow is reduced, you get poor growth and malnutrition. They have special formulas that have these medium chain triglycerides and water-soluble vitamin supplements that will help maximize the child's growth and development. I think I'm going to go ahead and stop and do another one.